Hi guys, my name is Sydney Wessner and I am a recent graduate of Drexel University's nursing program. I will speak highly of it any day of the week. I believe it set me up the most in comparison to my peers for a awesome start to my nursing career, and I would recommend it to anybody. I did 2 co-ops in 4 years, so I kind of hijacked the system a little bit, but loved every single opportunity and really wanted to maximize my time at Drexel so that I could get the most out of my experience and build my resume exactly how I wanted to get me to the job that I have today. My first co-op was at the intensive care nursery at the hospital of the University of Pennsylvania. I loved my time there, where I got to work with the NICU population and some amazing providers and nurses at Penn to do administrative work for the unit, some stocking, and just learn all about those sweet little peanuts. That helped open a door for me to work on that unit as a CNA, where I worked for a year and a half. Fell in love with that population and I was like, oh, I might want to be a NICU nurse. Going into my second co-op then, I was like, okay, I did Penn. I feel like it's time to do CHOP. Coming to Drexel, I wanted to have both of those on my resume at graduation, and I'm so happy to say that that is the experience that I have. So amazing opportunities. In my second co-op at the Children's Hospital of Philadelphia, I worked on a surgical trauma unit where I saw a vast population of different pediatric patients from an orthopedic, gen peds, trauma, and gen surg setting. So it was a really wide variety of a bunch of different types of cases, and I also really like general pediatrics. So I had the opportunity then come fall my senior year where CHOP offered me a nurse residency position, which I took and which is where I am now. I currently work in the cardiac ICU at the Children's Hospital of Philadelphia, but I'm in a float pool position, so that means that I will rotate specifically in the ICUs between the cardiac ICU, the NICU at CHOP, and then also the general pediatric ICU. So far, I'm loving my time in the cardiac ICU. I really loved critical care while I was in school, and then taking my experience in the NICU at Penn and then on a med-surg floor at CHOP, I feel like I had the perfect culmination of things to give me a really solid foundation going into my nurse residency position that I have now. I could not speak more highly of all of my time at Drexel, from the faculty and staff and support of my peers to set me up to reach all of my hopes and dreams. I had the opportunity to also serve as the co-president for the Drexel University Student Nurses Association, where I had opportunities to connect with other nursing students across the nation and help learn about different graduate programs and research that I could be doing in my time at Drexel to better my student experience and care of my patients. So kind of all of those things together really helped set me up and open so many doors for me to get the dream job that I have today. When I was in high school and I was applying to schools in the Philadelphia area, I wanted to work at Philly hospitals. They are highly accredited and have amazing programs, so that was where I set my sights. Then Drexel opened up doors so easy for me to work at some of the top hospitals in the country and gain next level experience. I would recommend Drexel any day of the week if you couldn't tell. And I absolutely love where I am now, and I'm so grateful to everything that I've learned along the way. So I hope you'll choose Drexel too. It's definitely worth the time.